I'd like to inform everyone that we do have rules. You're welcome to offer any public comments that you wish to offer. We just ask that you be respectful. We prefer to not have any screaming, yelling, profanity, and I'd ask that you treat people with the same respect that you would expect from others. So with that being said, we'll do the roll call. Abbas Kamara, Gail Moss, County Controller Corey O'Connor.
Here.
Terry Klein.
Here.
Rich Fitzgerald.
Steve Borski for Rich Fitzgerald.
Sheriff Kraus. Here. Is anyone else is missing? Pat Katina.
Bethany Hallam.
Thank you.
Judge Halsey?
Judge Lazara is absent as well. Yes, ma'am.
Judge Halsey, I'd like to object to Mr. Polarski voting illegally in place of Rich Fitzgerald.
All right, that'll be noted in the minutes. Thank you. With that being said, we'll now have a presentation on the Pitt School Social Work Survey by Aaron Dalton.
All right. Good afternoon, everyone. I'm Aaron Dalton. I'm the Director of the Department of Human Services, and I'm joined by Dean Farmer from the School of Social Work. I'll give a little bit of kind of background on how we got here today. I'll invite Dean Farmer to go over the results of the study. We can offer some opportunity for the jail to give some comment just on some of the reactions and things that have been done, that have been going on that might be responsive to the survey results. And then if it pleases everyone, we can have some time for question and answer. Everyone should, I think the board has received a copy of the results of the study. Yeah? Okay. Great. So just a little bit of background. The survey itself was a request from the Inmate Welfare Fund, the subcommittee of the Jail Oversight Board. The purpose, I think, the primary purpose was to determine how to effectively and appropriately utilize proceeds generated from commissary sales. Also offers the opportunity to get a kind of a point-in-time snapshot on conditions in the jail, people's feelings about services and so on. DHS worked with the School of Social Work and provided funding both from the Inmate Welfare Fund and from County DHS. And we're so pleased that Dean Farmer could join us here today to present the results of her team's study. Just as a point of reference, you probably know this and you probably saw it in the results, but this data was collected around this time last year, so late summer, early fall, in the height of the pandemic. It is and was a point in time, so it's sort of one snapshot in time during the time people are in jail or in the history of the jail. I do want to just mention a little bit about the way the data was collected. It's pretty impressive, both the work of the jail and Dean Farmer's team in getting such a high response rate. It's not super easy to get people to complete surveys like this. So I think a lot of effort and time went into thinking about how to do that. So the team collected the data on paper, and they were provided the survey by a senior correctional officer, not somebody who's regularly a senior jail employee, not somebody who's regularly on the pod. People were given the survey with a cover note, an envelope. They received an incentive if they turned it in, and I think. It seems by the response rate, felt like it would be confidential and they could provide their feelings about the conditions in the jail. So an 89% response rate is almost unheard of. I can let Dean Farmer talk about that. And in 72% of folks also offered open-ended responses. So they didn't just kind of fill it out. They took time with the survey. So I'm grateful to the team in the jail and to the school social work for getting that kind of a response rate. Just a little bit more context setting. So this isn't the only kind of survey results or focus groups that the jail and the county conduct within the jail. So we regularly seek feedback. Department of Human Services partners with the jail on this, but it's hard to do at a time of COVID. So this is the snapshot from that period. So really glad to have that. Obviously, this was conducted at a time that's really unusual in the jail's history, in our history, where we're following CDC lockdown orders and really working to keep people safe. And so while I think it's a super useful view of that time period, it's not necessarily representative of what's happening there today or what can happen in a truly post-pandemic jail setting. I just want to also mention that, and you guys are probably aware of this, but over half the people booked in the Allegheny County Jail stay there for 15 days or less. And as such, they come in and out frequently. A survey like this, by definition, essentially overrepresents people that are there for a long time. So we're more or less getting the experiences of people that are there for a while. It's also worth mentioning that for people who are there for such a short period, it doesn't offer tons of opportunity to provide long-term services, resources to people that are staying there. So just want to mention those as kind of background and context setting. Nonetheless, I think it is a really useful snapshot of the experiences people had at that time, and we're interested in this kind of work, and hopefully can continue to do this in the future. All right, with that said, I'll turn it over to Dean Farmer.
Thanks very much. And hello, everybody, this afternoon. So I'm going to run through, I understand that you have all seen the report, so you have read it, so I am not going to bore you with repeating everything that you've already read. I do want to add a couple things to what Aaron provided in terms of the approach. This was a fairly long process in terms of being developed, and so we worked with the Inmate Welfare Fund subcommittee, as well as jail personnel, as well as folks at the county, to make sure that we had a survey that made sense, that was going to get the kind of information that would be useful and needed. Yes?
Yeah, I just want to say, first of all, we only got this at 9:13 this morning, even as a board, so I'm going to guess that not everyone on the board has read it, and also I know no one who's watching the meeting has seen it. So if you don't mind, I know you said you wanted to skip a summary. Would you mind giving one just for?
Oh, I'm not skipping a summary. I was just going to say I was not going to read you all the statistics to in a terribly boring way.
Okay,
but I will give you the summary and the take-home messages from the sections.
Perfect. Thank you so much.
Yes. But I think it's important to think about what we were trying to get at here. We were actually approached by the Inmate Welfare Fund subcommittee to begin this process with the idea that they were responsible for utilizing the proceeds from the commissary, and they felt like they needed some more information to be able to make responsible decisions about that. And so that's how we approached this. And we tried to ask questions about areas that they had expressed interest in knowing about, and that we thought would be useful to know in terms of things that those funds could be used for. And so it was a fairly iterative process to create the survey. We didn't just like sit on the 21st floor of the Cathedral of Learning, which is where I am, and make this up out of thin air. We talked with people to try to get things that would be relevant. And so that is what we did. As Aaron mentioned, it was a very high response rate. It was also, as Aaron mentioned, a time of maximum lockdown in the jail. People didn't have a whole lot of activities that they were able to do. And so this was something they could do, and I think they found it, to be something that was worthwhile, and they wanted their voice to be heard. So we appreciate everyone who took the time to complete the survey and to get it back to us. And that is kind of how we did it. I also wanted to emphasize something that Aaron said in terms of confidentiality. We did assure the respondents that their responses would be confidential, that we would not report anything that could be linked back to an individual person. So as you're reading the full report, we do include some open-ended responses from the things that folks wrote on the survey to us. And also, as Aaron said, that part did surprise us. 72% of the people who completed the survey took the time to write out responses to us, often in response to things that we asked, but sometimes in response to things we did not ask about. And so they clearly took it seriously and put a good deal of effort into it. But it was also, as Aaron said, they got a survey and an envelope, and then they put the survey into the envelope and before they turned it back in. So they sealed it so that they had a sense that no one in the jail was going to see it before it came to us. They were all sealed when they got to us. We opened them and then did data entry and analysis. And they could have turned in a blank survey. There was nothing that prevented them from just putting the survey in the envelope. The incentive that the jail suggested would be meaningful and that people would appreciate was a Pepsi. And so we had 1,700 Pepsis delivered to the jail, which was an interesting process in its own right. But let me just start with the results. The response rates, high response rates are always good. The important thing about the response rate or the sample, though, is it representative? And we had some data from published reports and from publicly available data about what the population of the jail looked like around the time that we were doing this survey. And as far as we can tell, this was representative in terms of gender distribution, in terms of racial distribution, in terms of all the kinds of things that you would expect in a survey. Aaron mentioned also that approximately half of the people who are in the jail are there for a very short period of time. It's also important to note that 81% of the people who completed our survey reported that they had been in the jail previously. So we do not know in terms of their responses on this survey if they're talking about their current period in the jail or if they're talking about some other experience they had with it. But I think that's important to know. So we asked questions in a variety of substantive areas, and so I'm going to kind of go through those substantive areas and just give you what we found, and then I'm happy to answer questions. The first area we asked about was basic needs. This was one that the Inmate Welfare Fund asked us to look into and to ask questions about. A minority, about 28% of the respondents, told us that they had everything they needed to maintain basic hygiene, was the way that the question was worded. And when we asked them about where they got hygiene items from, the majority of them, 82%, reported that they purchased hygiene items from the commissary. This is not to say they were not being given things by the jail. This is just to say that for them to do what they wanted to do, most of them were buying items from the commissary. Let's see. We gave you a whole list of the types of items they most frequently bought. So in terms of the Inmate Welfare Fund, thinking about these data in terms of what might be useful to use funds for, to help support people who are currently incarcerated, there are a bunch of things. They're very simple things like soap and toothpaste and shampoo and deodorant and those kinds of things. There also were some food and clothes and socks and things like that. We also asked, we were particularly interested, as you all know, the jail is predominantly male. And so we wanted to make sure that the results were not that any issues that women were experiencing were just not seen because there were so few of them in our sample. And so in the longer report, we break out all of the analyses by gender just to make sure that if the women were reporting something very different than the men, that we would know that. There are not very many areas where that is true. I will point out one today that we found. But for the most part, men and women reported very similar types of responses. The one area where we did ask women only was about menstrual products. And it appeared that there was 29% of them said that they mostly had access to necessary products, and 35% indicated that the products they had were sufficient to meet their needs each month. And so that appeared to be an issue in terms of what they were receiving. The next area we asked about was health. And we asked about medical care that they had experienced or received. A small percentage indicated they were not even aware that the jail had medical services. What that means, I don't know. I would assume they didn't have any medical problems while they were there, so they hadn't had to access them, and they did not know anything about this area. Overall, there was a fair amount of dissatisfaction with medical services. 66% of the respondents reported that they were either very unhappy, so about half, 49.7% reported that they were very unhappy, or somewhat unhappy. 16% reported that they were somewhat unhappy with medical care in the jail. The primary issues that they reported, and we asked them open-ended kind of what were, we had a variety of questions, but the summary from analyzing the open-ended questions, the two main things that they reported was wait time, so having extended times before they received treatment, and not receiving proper medications for chronic conditions. The most frequent thing we saw there was folks who were diabetic not getting insulin in a regular and predictable way. So those were the two big things that we got there. In terms of mental health, we included some standardized instruments because we thought it was useful to know what was the rate of mental health problems within the folks who were in the jail at the time. We used a standardized measure, and what we found was that approximately half of the men and 44% of the women, based on their responses to a set of standardized questions, suggest that they have symptoms that would place them in the range of having a serious mental health disorder. We did not ask follow-up questions about mental health care because that was not something, as we were talking in creating the survey, that was not something that was really seen as the purview of the Inmate Welfare Fund. That was more something that was a functional service of the jail. So we did not ask a lot of follow-up questions. Folks did have open-ended responses to that, but we did not have any prompt that was consistent there. We then asked them about a variety of daily needs. And so one of the questions that the Inmate Welfare Fund asked us as one of their first questions for us was that they had heard concerns that people were not comfortable in terms of temperature and not having adequate clothing within the jail. And so we asked them about being too hot, too cold, did they have clothing that was appropriate for the temperature. And so about 37% of the respondents said that they were often very uncomfortable in the jail with the temperature. Another 34% said that they were somewhat uncomfortable. Only about 25% indicated that they felt they had sufficient clothes and/or covers to stay warm. We also, in this section about kind of comfort and such, we asked questions about sleeping. Most of the respondents reported that they did not sleep well. There were a variety of reasons reported for that. And one of the issues that was reported was the timing of sleep medications was a bit of an issue because they were getting them at around 4:30 in the afternoon, which was too early to actually do much for their sleep, obviously. Another area, this is where we asked about food. We got lots and lots and lots of open-ended answers about food, as you might expect from this population. 72% said that they were very dissatisfied with food. We asked about a variety of different issues around food, and some of the things that we got responses on were around quality of food, quantity of food, perceived cleanliness of food, and such. 76% of folks who reported that they were on a special diet reported that the food that they were served did not meet their dietary restrictions or requirements. We also got a report that approximately half, 53% of the respondents said that they frequently went to bed hungry, and an additional 35% said that they sometimes went to bed hungry. Open-ended responses in this section suggested that folks were buying things in the commissary to meet their food needs or to meet their perceived food needs. And we got a lot of comments about the price of the food in the commissary. And some people were very detailed. They gave us a very exacting list of what the prices in the commissary were for foods that they bought at the grocery store for a very different price. And so we heard a lot about that. In terms of, we asked them, we did this survey, you'd have to correct me, but I believe it was about 6 months after they got the tablets. Is that about right? It had been,
It's a year.
almost a year, okay. So they had the tablets for a while. And I have to say, the tablets appear to have been a godsend during the pandemic because they spent a lot of time on them. At this time, people were not allowed in the jail, which is why we did not collect the data by ourselves. And families were not allowed to come visit. And so tablets were serving a lot of purposes. They were both a means of entertainment during the day, and they were also a means to connect with family and friends in the broader world. 94% of the respondents said that they used the tablet every day. And they used them for a variety of activities, as you would imagine. They were watching movies on them, they were doing video visits with friends and family, they were reading, a whole bunch of stuff. Only about 4% of the respondents said that they definitely had enough money to cover the paid material that they enjoyed using on the tablets. And so about 48%, 34% said that they never had enough money to cover paid material. In addition, additional 48% said they sometimes didn't have enough funds to cover the paid material on the tablets. In terms of contact with friends and family, this was, again, no one was allowed in the jail to visit, but folks had a lot of contact with their friends and family. About half indicated that they were in touch every day or almost every day, and an additional 25% indicated that they were in touch a few times a week. So about 75% of the respondents indicated that they were having contact with friends and family at least once a week or more. Telephone was the most frequent way that they communicated. About 83% of the respondents used the phone to communicate, but the tablet was the second most common, with about 72% saying they were using that. Let's see. We have one more section, I believe, and then we are done with how we've summarized this. So we then looked at just activities that they were doing while they were in jail, and we asked about some things. We asked about exercise, and this was a tricky area to ask about because they were on 23-1 lockdown when these data were collected, and so they didn't have a lot of time when they could go do activities or exercise anywhere beyond their own self. And so this is the one area where we found a difference between men and women. And probably not surprisingly, the men reported exercising much more than the women, and the men also reported that they were less satisfied with the amount of exercise they got to do than the women. Or more satisfied, excuse me, I said that backwards. So the men were exercising more, they were also somewhat more satisfied with the amount of time they got to exercise. They also did different types of exercise. None of this is going to be surprising to anybody. Reading was a very interesting area. It was a huge activity that was reported by 76% of the respondents reported that reading was a common activity for them, and they spent quite a lot of time during the day. We got their own self-reports of how much time they spent. Those, it's a little difficult to know exactly how accurate those are, but people certainly were reporting that they were doing a lot of reading. One of the things that was interesting also is that most of the folks who completed the survey indicated that they felt like they read fairly well. Not that they were not illiterate, and they had skills. And their written responses would support that. They certainly looked like they were understanding the questions and responding in ways that indicated that. But many of them suggested they would like to learn to read better, and so that was one of the areas where they suggested they would be interested in a program that might be there. They also indicated they would like a broader range and more kinds of reading materials, and there's a whole list in the reports of what kinds of materials they would possibly enjoy. And then the final thing I'm just going to report is on religious activities. We were interested in their access and their use of those. 57% indicated that they frequently engaged in religious activities, and 31% said they frequently engaged, 26% said they sometimes engaged, so 57% indicated that they engaged in religious activities with some regularity. That included, given the lockdown and the COVID situation, a lot of that was individual, a lot of reading materials, a lot of prayer, a lot of, and there was some participating in religious services too. So overall, we got feedback on a variety of topics. The full report that you have in front of you lays out kind of a narrative where we summarize things, and then gives you a lot of tables where we provide the data that we collected if you want to look at it in more detail. And that's kind of what we have to report to you all.
Judge? Yep. Oh, just one thing real quick. If the board, I actually have a motion to add these results to our minutes so that they can be open to the public if the board would
Second.
agree. Aye. All right, thank you for that. Just a couple questions, and I can email them. Obviously, 89% is a great answer or response. So, and this is more for the warden and everybody, but can we look into doing this more often? If you got, and I'm not putting it on Pitt, but if you're open to that, I think that would be great to get more of these results, especially if your numbers are that high. We can get more effective use out of this, maybe twice a year, half a year. And Warden, I don't know if you want to answer that now or if you guys have already thought about doing something like that.
Sure. Good afternoon, board and everybody in attendance. We are planning on doing this survey at least annually. That's what
Okay.
we're looking at right now.
Once a year right now?
Yes,
Okay.
sir.
And same Pitt social work would do the same?
We have not talked about this.
Okay, all right,
But,
sorry.
I think the intent was to repeat it because of
Yeah.
the contextual factors that were so unusual during
that's-
this time. It would be very useful to do it again. And I think there are also, I would assume, as you look at the results, there are some areas that you would not want to repeat the questions that were asked this time. And there are probably some areas where you'd want to have more or different questions. And there might be areas that we didn't cover this time that would be of interest. So absolutely, I think repeating this is always a good idea.
Okay, no, thank you for that, and thank you for at least.
But we have not at this point.
I didn't want to put
been
Pitt on the
asked or
spot.
signed on
Yeah,
for such an
I get it. But some of your questions, and you actually sort of answered, but I have a follow-up, like the 82 that responded to the use of the commissary. Now, we had an RFP that I believe is going to be awarded within the next week or so. So my question's more for the awardee, and I assume that there's something in there, but can we get a cost estimate of what, the basic needs, like we're seeing toothpaste, toothbrush, deodorant, what that would cost additional to what's in the RFP? Like for more inmates to have, or I shouldn't say that, for more residents to have, just basic needs that if it's additional cost, at least we would know what that is. I don't know if it's, I assume the commissary is part of the RFP, but if these things are given to residents that they don't have to pay additional, what that cost would be. And I don't need that answer right now. I'm sure you don't have it.
So I can give a little.
Oh, you do want to answer? Oh, sorry, thank you.
So if the question is in regards to having larger quantities, we do have these available on the pod. We're expanding what we offer. Like we don't carry one type of toothpaste, whereas if you want something different or your brand specific, that's when you would go to commissary. So is that kind of where you're going with?
Yeah, just to see, the new RFP is out, it's awarded. Is the new group that wins, are they going to provide more of this basic needs and so that somebody doesn't have to always go to the commissary? That's sort of my question. I understand the specific need of somebody to use a certain deodorant, whatever it might be, but my question is like, what would the cost be to ensure that all of these products are given, whatever that additional cost would be, that you're seeing an intake of everybody's using this type of toothpaste? How much more would it cost us to purchase
Okay,
that?
I understand. So if
Yeah.
we're looking at what the commissary purchases have been in the past, and
Yeah,
then
just
reflecting
your-
that upon how that would impact our operating funds for
The
if we were
future,
to
and
have that.
what that number would be, yeah. And I'll email you these questions. I know, the survey just came this morning. These are just some of the things that I sort of thought of while we were reading through it. And then the last point you brought up about religious services, or individuals that have religious services, or you said 57%. And I know that group settings have changed since then. So, my question is just, are we doing more of those types of services that are in group settings from when this survey occurred? So if you can get me that number that, how many more religious type services, basic services, meetings, mental health meetings are now in a group setting from when the survey was done?
So, Mr. O'Connor, we are providing more in-person religious services for our incarcerated individuals. And at one time, we was even bringing them down to the chaplains department until we got an increase in COVID. So one of the things that we're making sure that we do is providing religious services. As far as like mental health services and everything, we're still trying to provide that as much as we possibly can.
Yeah, the group setting one, those numbers were obviously understood through COVID, but, we're still in the pandemic, but now that we're out, it would actually be helpful to see what we did prior to how many group settings we had, and what we can provide once we hopefully get through this. So just a question if we can get those numbers.
And you know, another thing I want to say to you, Mr. O'Connor, is this. We still are providing religious services for a particular pod. We're not mixing pods, you know, because we're still in the middle of this pandemic.
Yeah, no, I understand that. I'm more or less looking at, you know, has the group settings grown, what they used to be prior to pandemic, and, you know, hopefully there's an end game here and what that would go back to, because that number kind of stood out to me as well when you gave the report. So thank you. That's all my questions.
Thank you. So my first question is for Dean Farmer, but first of all, thank you so much. I feel like this was a long time coming, and I know a lot of people who are on this board worked very, very hard with your team to make sure it happened. So I just want to thank you. This is the most information I've ever gotten since I've been on this board. So thank you so much. My first question that is for you is, when was this report completed? It says July 2022. I'm just wondering, like, when was it finished?
We turned it in, I would have to look back exactly. We gave it to the county in early August.
Early August, cool. Okay, thank you so much. Now, some of my other questions, I guess, are for anyone up here who wants to answer them. Some of the stuff in here is wild. I mean, I know when this ended up in my inbox this morning and I'm cruising through it, I just couldn't believe some of these numbers. So I want to, you know, specifically just highlight, I know you highlighted a couple of them, Dean Farmer, but 82% of people in the jail purchase hygiene products from commissary. I mean, like, hygiene products, right? So I know a question was asked if we can try to get ones that they're purchasing from the jail, but my question is, why are we not providing adequate commissary items? Because it's not just brand. It's not just brand. That wasn't what the question was here. There was a question that said it was 30.6% indicated that they were given hygiene products from the jail. So only 30% of people in jail were said that they were given hygiene products at all. It doesn't say, did you get your favorite brand of toothpaste from the jail? So I'm just wondering if you can speak to, in what situations has there been no hygiene products available? If you're claiming that it's not all the
Can I clarify
time.
for 1 second?
Yeah, please.
It's the 30% is adequate, enough sufficient hygiene products from the jail. It's not that the other 70% are saying they got nothing.
Appreciate that clarification, Dean Farmer. Thank you.
So I would like to respond. And the first thing I would like to say, thank you, Ms. Farmer and the Pitt School of Social Work for doing the survey. You know, and again, we're showing that the ACJ is progressive and innovative.
No, you're
and
not.
we welcome the results of this survey. So I'm going to answer your question pertaining to hygiene items on commissary. Every individual that comes into the ACJ is provided with socks, T-shirts, underwears, soap, toothpaste, shampoo, all the hygiene items that they need upon entry into the ACJ. And also we have those items on the cell blocks in which they can go to the correctional officer at any time to ask for those items. Now, individuals at our facility don't like the type of items that we have available for them, so they decide amongst themselves to utilize the commissary. So it's not that we don't have the commissary hygiene items for them. They decided to purchase commissary hygiene items because they don't like what we have for them.
Okay, so now I'm going to tell you how I know that's a lie. I have been on the pod when I have seen not even toilet paper available when people need it. Second of all, 29% of menstruating people indicated that they mostly had access to menstrual products. So I have also been on the pods watching people use socks, use toilet paper as menstrual products. And these numbers here clearly demonstrate that. So are you claiming that these results are a lie, that people are lying?
I'm claiming that you have not been in our jail for many of years, so we are not lying. So I want to clear that up first of all.
I was in the jail a
let me
month and a
finish.
half
Let you
ago.
talk, Ms. Holland, let me talk. So first of all, we are not lying. We provide these items every single day of the week. So I disagree with you, and we are not lying. And I'm not going to continue to have this bickering thing with you. We had the items available.
We're not going to bicker. Warden Harper. We are going to have a conversation, as in my statutory duty to ask these questions on this board, as is your duty to answer them. So I just want to clarify that first, though. Okay, and you can sit there and smirk. I'm not talking about when I was incarcerated in the jail. Thank God I'm not incarcerated there today. Who knows? I'd be dead. I'd be one of the names that they're reading outside in a vigil. Who knows, right? I'm telling you that in my visits to the jail, just since I have been on this board, I have seen instances of people who do not have access to toilet paper, of people who don't have access to menstrual products. You're right, I did not specifically ask about toothpaste, but those are hygiene products that I know were unavailable to people, at least at certain points that I was there. So that's what I'm asking for an answer to. Are you indicating that people are lying when only 29% indicated that they mostly had access to necessary menstrual products?
So we did address this earlier this year, where we identified that we weren't offering a large enough line of menstrual products. If you remember, you made a motion, which we already actually put into place. So we did increase the type of product, realizing we were only offering one type, and we expanded that as well as our delivery of those. So as our population volume changes, as well as our population type, we need to more be reflective and look at that as far as what those products are. So we have started that, and we did do that, and one of them was the menstrual product. So we are looking reflective upon those changes within our population and making those adjustments to our inventory. In regards to the other pods, we do know the frequency of which we are delivering those. Maybe we need to look at increasing that frequency based on this information, and that's something that we have to do, and that's something that this will allow us to do by providing us that information. So absolutely, I think that just as you said, just as we've all said, that we got a lot of information from this survey, and we need to look at what changes we've made from this survey point. It was done last year, and we have made changes, and see if those changes made an impact. So this is a point in time. So that secondary survey that, Mr. O'Connor asked for, that we can see if they've made an impact.
Okay, thank you. So speaking of those changes, so you talked about the menstrual products that we've discussed before. What other changes have you made since this survey in regards to things that were surveyed upon?
So in this survey, one of the other things that we identified was the increase within the clothing that an incarcerated individual would receive upon entry. We haven't made that change yet, because there's a lot of other factors we have to make into consideration, safety and security reasons, but those are things that we're looking at as far as what they are receiving at that time, so it takes that less burden off of them, and also reflecting on what impact that's going to have on laundry services. We increase what we're giving. We also have to maintain how we're going to replenish that when it's damaged, as well as how we're going to manage that within the laundry service. So it's not just a single action of give them more. It's how is that trickle-down effect? How is that going to impact other services that we have to do within the facility itself? So those are things we're looking at.
Okay, so you said that specific changes were made, not hypothetical down the road. I mean, we've heard a million times these things are going to change. I'm asking, what are the concrete changes that have been implemented since the survey in regards to the things in the survey that have been implemented?
I would have to get back to you on those specific ones as far as it applies to the items that we just referenced, but one of the ones that we are going to make is the clothing.
Okay, have you addressed toilet paper shortage at all?
This is the first time that I'm addressed. We had purchased, I guess I would have to ask what the question is.
We don't know anything about any toilet paper shortages, Ms. Howland.
We've talked about it in these meetings before, you and
No,
I,
we
Warden
have not.
Harper. We
No, we have
absolutely have.
Ask that you not speak out from the audience, please.
Okay, I'll move on to the next subject. So that was hygiene. Okay, so now medical care. This is the one that I think is truly the one that we should be focusing on. So 66% reported dissatisfaction with medical care in the jail. All right, so I would say that's a pretty high number, but I think the most pertinent thing in this survey is some of the quotes that people gave in their own words to the issues with medical in the jail. It's been 2 months since I submitted 2 sick call slips. Still no doctor visit. I'm a veteran with service-connected disabilities with a rating of 50%, and I'm not getting the care I need. That's one of the comments. Another one, came in the jail at 170 pounds. After 3 days in the booking process, was down to 160 as a type 2 diabetic. Took me 4 days to get my prescribed meds. It took over a year of incarceration to get my insulin right. Sometimes I didn't receive that insulin. This is something that we hear over and over again in meetings. And another one, my social worker emailed the jail 4 months ago to have me seen by mental health. I still haven't been seen. I am bipolar and unmedicated. So these are things that we talk about here over and over. It's what people come up and give public comments on all the time. So I just want to know, like, when you all have read this, because it sounds now that you've had this a lot longer than we have, so can I assume that the jail administration has reviewed this in its entirety? Can I assume that you all have read this?
We have.
Okay, so then I want to know, when reading this, what was the first thing that comes to mind? Like, what was the thing out of what I've just read in regards to the medical that concerned you most?
As I stated before, Ms. Howland, we take all of the input from our incarcerated individuals seriously. As Ms. Dalton and Ms. Farmer stated, this survey was taken during the height of the COVID pandemic. We do everything in our power to try to service our incarcerated individuals as quickly as possible. It's just like when us in the community, if we were to make a dentist appointment or a doctor appointment in the community, you during the heightened COVID thing did not get immediate medical services. None of us did during the COVID pandemic. So we did everything in our power to make sure that we provided the services that was needed as timely as possible.
I just went to the emergency room last week and got immediate medical attention for an emergency. So
That was last week. I said during the COVID heightened period.
okay, at some period during the COVID pandemic, I have seen people go to the emergency room and get service, a privilege that people in jail don't have. We have seen people die from medical emergencies in the jail, 16 since March of 2020. 16 people died, mostly of medical-related incidents. So what I'm wondering is, if you've had this for weeks now, and you're reading the same stats I'm reading, unless you're claiming that this survey is false and that these people are lying, what are you doing to fix this? Because sick calls, not getting insulin, not getting medication, I mean, are these not things that you think need addressed right now?
The emergency room, we have an emergency room. When we have medical emergencies, our medical staff have 4 minutes to respond to all the emergencies in our jail. Therefore, if medical attention is needed, our medical staff is there to take care of those medical issues.
I was going to point that part out too first. So I did quickly get through to what we had been reporting on wait times at that time. So at that time, our wait times for the first appointment to medical was 8 days. And their wait time for psychiatry was 39 days. So that's, from what we heard that you just quoted, was that it was months. So I just wanted to point out that it was 8 days for first to be seen by medical, and these are non-emergent. These are non-emergency healthcare requests. So like the warden said, emergency would be within 4 minutes we're on the scene.
So that's the average wait time. Are you claiming that
No, that is
the maximum?
That was the wait time that day.
So you're saying that no one has ever waited more than 8 days for medical, 31 days for a psychiatrist?
No, what I'm saying is the monthly report that I have is at that time, the wait time was 8 days. The longest waiting was 8 days.
Okay, so what I'm asking is that, what is the longest time that anyone has waited for medical or mental health care?
Ever, I don't have the information with me, but what I'm saying is at that time, the longest wait was 8.
Okay, I appreciate that. And then, you know, I want to just remind folks that incarcerated people are the only group of people in our country who have a constitutional right to health care. So comparing what happens on the street to what happens in the jail is not the same thing, but yet they often miss my chronic condition medication and antibiotics. They're careless. I'm a diabetic, and there are some days I don't get my insulin, whether it be because the jail is on lockdown, medical is short, etc. Prescriptions from outside have not been provided. Constantly go without meds for days waiting on refills. Short-staffed a lot and very sporadic med times. So do you also have an average wait time on people to get their medications that they come in prescribed to when they come in off the streets?
I don't have that with me.
Okay, so have you seen instances in which people waited days for their prescription medication?
No, I have not.
You have never seen that? Because I've had it reported to me many, many times. That's not something you've ever seen. This is the first time that you're hearing about it in this survey?
Waiting days, correct.
Okay, thanks. Okay, so next, I know we talked a lot about like temperature and how only 6% of respondents reported that they sleep very well. 6%. So I just want to highlight that for 1 second. Only 6% of the people in the jail are sleeping well. Also, so repeatedly it was expressed about the sleeping medication. I don't know if someone here can speak to specifically what the recommended time is for people who are prescribed sleep medications, what time they should be getting it, and what time the jail is providing those medications.
As I've stated before, Ms. Hallam, during the pandemic, we were late in prescribing medications during the height of the pandemic, and I've reported that on several occasions during the Jail Oversight Board meetings.
Okay, and we're still in a pandemic. When was the height? When were these issues resolved? At what date did the height of the pandemic end and operations return to normal?
During the time of this survey, which was September of 2021, that was the height of the pandemic. We have greatly improved all services since we are almost back to normal. But during the height, we were late getting medications to incarcerated individuals, as I've reported before.
I understand that that's what you're saying, and if you were listening, that was not my question. My question was, since you were specifying that you know that this survey was conducted at the height of the pandemic, and you know that at the height of pandemic, these issues existed, what I'm asking is, when did the height of the pandemic end and these issues that we're hearing about cease to exist?
I cannot answer that right now as to when it actually ended, Ms. Hallam. I cannot answer that.
But you're sure that this survey was conducted during it, and we're definitely not in it now?
I'm sure that the survey was conducted during the height of the pandemic.
Okay, so next I want to ask some questions about food, which it was very interesting. I actually love the incentive idea. I know when I was in there was like some Inside Out program where you could order, you know, like cheeseburger and pop, and it cost a lot of money, but it was like the one thing I look forward to every week. So I don't know, is that still a service that you can get?
It is not.
It is not. Okay, so this was maybe the first time people have had pop in a really long time. And so it was really interesting to me to hear that that was possible, because maybe we can look at that as, you know, bringing in outside food that is more adequate going forward. So I'd like to talk to you about, you said it was a process, how it happened, because I'm really interested in doing that, especially because 72% of people were very dissatisfied with food in the jail. Food comes up hours late if it comes at all. So, okay, you can say that's a COVID thing, but what about plenty of times where roaches were on the food cart? Many times I found pebbles, which I'm guessing are like, I don't know, turds of roaches, on the trays mixed into the food. Rat feces, okay, I don't know pebbles, but that's just the context. So I'm wondering what has been done in the jail since this survey was taken to address roaches on the food cart and pebbles on the trays mixed into food? Because we've also seen reports from the Allegheny County Health Department indicating similar things. So I'm just wondering what is being done to rectify.
And as we stated, several jail oversight boards on many occasions what we're doing, so I'm going to explain it again. We have an exterminator that comes twice a week that exterminate all areas of the jail. We also have, we just put out an RFP, or we will be putting out an RFP for a food provider. So that's going to be put out hopefully next week. And just basically cleaning and sanitation. We're cleaning more, we're sanitizing more to make sure that we don't run into these issues again. So this is a 1 million square foot facility again, you know, and we're doing everything in our power to make sure that issues like this don't take place going forward. And also with the health department reports. And everybody has access to the health department reports. And in January, February, we had some issues. But if you look at the health department reports as of late, they have been greatly reduced. So let's talk about what we've done to reduce the issues that we had prior.
That's actually exactly what I'm asking. So I'm specifically wondering if the what do you call a pest person exterminator, if the exterminator, did they cease to come twice a week at the height of the pandemic that you're referencing?
They continue to come twice a week, ma'am.
Okay, so would you agree that the roach and pebbles problem is not something that is unique to the height of the pandemic?
I'm saying that issues was brought up pertaining to pest management, we have taken actions to correct those issues by talking to the exterminator, exterminating more, and just basic sanitation. That is what I'm saying.
Okay, so are you doing more cleaning and sanitizing now than you were at the height of the pandemic?
We're trying to clean as much as we possibly can, yes, ma'am.
And it's more than you were at the height of the pandemic?
Yes.
Okay. And what I'm wondering is, would you eat at a restaurant where in January or February of this year they had roaches or rat feces in their food?
We're not asking what I would do in my personal life. So I'm not even going to comment on that. I'm going to comment on what I'm going to do as the warden of this facility is make sure that that does not take place again. So I'm not going to talk about what I would do in my personal life.
I just thought that maybe since you were talking about what I would do in my personal life if I had a medical emergency, that maybe it was appropriate what you would do in regards to rat feces and roaches in your food. Would you expect a person to eat food that had roaches and rat feces?
Absolutely not.
Okay, so you agree that this is completely unacceptable, and you have steps going forward to make sure that food at least never makes it to the pod that has roaches and rat feces in it?
As I stated several times, we are doing everything in our power to make sure that that does not happen, Ms. Hallam. I stated that.
Okay, and what about special diets? So this is something that people have brought up concerns about before, especially diabetic meals. So what I'm wondering is, it says 76% who have special diets for medical conditions reported that the food that they were served didn't meet their dietary requirements. So I know we had asked before for a dietitian to come from Summit, and we were told that that wasn't going to happen. But in the ACJ food service policy, it says that the menu should not only be reviewed and approved by a registered dietitian or licensed physician, but also the prison administrator. Is that you, according to this policy, Warden Harper?
That is me again, Ms. Hallam.
Okay, so do you review the special diets for medical conditions to ensure that they meet the recommended daily allowance for nutritional standards?
I refer that to our vendor's dietitian to do that.
But according to your own policy, it says it should be reviewed and approved by a registered dietitian or licensed physician and the prison administrator. And you said that's you, so why aren't you following this policy?
As I stated, Ms. Hallam, if the dietitian, which is Summit's dietitian, says that it's approved, then I approve it after the Summit dietitian approve it. So yes, I do approve it.
Okay, just going off of their word?
Can I talk about what
Please.
we're doing to try and improve this? Because like we said, there's a lot of things that a year ago we've identified and talked through these meetings that we want to fix and improve. And a main reason that we're doing that, doing what we discussed earlier of the RFP for dietary, is so that we can put and manage a little bit better with that dietitian. So one of the things, we're reviewing that RFP right now for finalizing and putting out. So that's directly being changed right now.
But are there any new steps that have happened since this survey was conducted and today?
That's why it's a very long county process to fix the issues that we have with the vendor. So I think we've been communicating that through each of the JOB meetings.
Right, but I've been on this board since, beginning of 2020, and we've been communicating it since then, and I'm just so sick, and I'm sure a lot of people are, including the people who are in there.
That's why we're changing the contract.
Right, so what have you done until then? What took this long? Because I know it didn't start when I got on the board.
Ms. Hallam, we have actually sat there and watched them prepare the meals. You came and you ate a meal, which was a great meal that
Delicious.
you said. So we are doing everything in our power to monitor the food of our jail, Ms. Hallam, and you were there to witness that amongst other jail board members, to include Ms. Klein, Ms. Hallam, and Ms. Moss. So we're reviewing the food every day.
Right, so I was there one day. You and your team are there every day. So we have seen, and I've seen, I printed out the menu substitutions. I do want to thank you for for posting those on the website.
And you're
you know?
welcome.
Yeah, so I can see the menu now and the substitutions that happen. And, you know, I understand that this is probably something that is being addressed by the new RFP, but most of the reasons for the substitutions are supplier issues. A couple, not enough workers, product didn't come on time. You know, nowhere on here does it say like the jail was locked down and that's why menu substitutions happen. But we've seen that happen and we've heard people talk about it. So I'm wondering, is there ever a time where food is substituted, emergency meals are handed out, and you're not documenting it on this food substitution log? I don't see anything that talks about that.
I don't know of any time that we did a meal substitution for a jail lockdown unless it was a COVID lockdown, you know, so.
Right. Okay, and why in these situations are you not bringing in other food from an outside vendor?
Because we are contracted with a particular vendor. We can't go to another outside vendor when we're contracted with one vendor.
What about the food that's already inside the jail that's being provided to the officers?
What about the food that's provided to the office?
Can that food instead be supplemented and provided to the incarcerated individuals, or is there some contractual obligation that requires you to serve two different meals to the workers and the people incarcerated?
In accordance to the contract, there are two separate items on the contract that says food for the incarcerated individuals and the employees.
Did you want to say?
Well, in part, the reason for that is the volume for the persons who live in Allegheny County Jail and the persons who work there. The persons who work there is much smaller volume, so that's where the original contract came into play, that it did separate the two because of spending and things like that, because of the volume.
Okay, and then is there a jail employee that oversees or supervises food preparation and service, or is it only folks from Summit?
Typically, it's some employees that provide the supervision, but there have been occasions where officers and sergeants have provided that supervision.
Okay, but it's not like a policy, it's just a random when they feel like it? Like you said, there's been opportunities for them to do it? I'm not sure I understand that.
There are occasions where officers and sergeants provide supervision of the inmates.
And in what situations are those?
If Summit don't have the appropriate staffing.
Okay. And, you know, I'm just concerned because I feel like if this kitchen wasn't in the jail, it would have been shut down by now. I see on the news all the time restaurants being shut down for so much less than what we're just hearing over and over again. And I just don't see new things happening. Like, I keep hearing these things are being addressed, these things are being addressed, but I just don't see any changes. We're handling it, we're improving, we're doing better. I'm just trying to get out of you like some concrete answer to what is happening different. So are we assuming together that this new RFP and the new provider are going to fix all of these problems that we're hearing about, the special meals, the meal substitutions, the lack of workers being there, rodents and roaches in the kitchen? Are these things that you're foreseeing will be fixed with a new vendor? Is that the problem alone, according to you?
There's several things that we're trying to do. We got a contract compliance monitor that we're ready to hire. That a management team, sergeants and captains are frequently monitoring the food process. As we just stated, we're going to have the food RFP posted very soon.
And when is it foreseen that after that vendor is chosen, that their services will be implemented and Summit's will end?
As of right now, Summit's contract ends December 31st of this year.
Okay, and I don't know if this is a question for you or maybe someone else on the board. Is there a chance for like an emergency contract in the meantime, just to make sure that there's adequate food provided from here till December? I'm just worried, especially about people with diabetes and other medical conditions, that their diet is really important. What are we gonna do if something happens to someone between now and then?
We're going to continue to monitor as we've been monitoring, and hopefully we can bring this contract monitor on as quickly as possible.
And with your monitoring, what do you do with the things that you monitor, the things that you see, the things that you find out with your monitoring? What does that lead you to do? Like, what changes are you making? That is really the overarching question I'm really trying to get, is are you just waiting till December 31st, I guess January 1st when the new contract starts? Like, what are you doing now, knowing these are problems, very, very widespread problems? What are you doing in the meantime is really what I'm trying to get at.
So one of the changes that was made to the current contract is we amended it to include a protein supplement, so to increase the protein serving. So that was something that has happened throughout the life of the current Summit contract. We do look at corrective action when we have issues with certain items, and we do engage the vendor. They attend our administrative meetings, we address issues that they have within the facility, and vice versa. So we are working to improve those process improvement plans, and that's something that we're building into the RFP for this one. Certain things that were not concrete in administrative roles and responsibilities and not clearly defined when we put it out as a bid. It lend itself more to however that company operated as opposed to us having more control and delineated duties and responsibilities. So that is something that we are changing, that is inserted into this new program.
Thank you very much. I appreciate that. So I really don't think I need to go over the commissary. Again, Dean Farmer pointed out the stat that I just thought was wild. 88% of respondents indicated that they went to bed hungry frequently. Oh, sorry, went to bed hungry. 53% went to bed hungry frequently. 35% went to bed hungry sometimes. So I just wanted to point that out. A lot of great comments in here. Somebody says they spend $150 a week on food, $600 a month. And currently people who are incarcerated have no way to make their own income. So this is being shouldered by the families, the loved ones, friends on the outside. So just wanted to highlight that. Next, I wanted to get to mental health, which I know we've heard about over and over and over again. And remember, mental health is healthcare, so incarcerated people are constitutionally guaranteed the right to mental health care as well. I get disrespect verbally. I have been assaulted physically. I have been tormented. I have not been able to cope or talk to someone who could help me, and I have felt abandoned. I feel this place is designed to break your mental health. I wish we had more support groups. So what I'm hearing here is what I hear when I go and conduct my inspections of the jail, and it's just people aren't asking for anything radical, anything extreme. I mean, support groups. Reading this, is there anything that you're doing or plan to do to increase access to support groups, whether it's with experts or just one-on-ones or group settings?
We have taken the steps to make sure that every employee at our jail receive mental health first aid training. So that was the first thing that we did this year. We're in the process of also doing de-escalation training, and we're also going to do crisis intervention training. So that's the first thing. We're going to make sure that our employees are well aware as to how to treat our mental health individuals. And one of the things under this administration, if anybody treats incarcerated individual other than how they should be treated, they're held accountable.
So we were talking about increase in groups. So at the time, like we talked about earlier, there were not group services going on at that time. As we have been working to develop some of our mental health staff, we have been trying to plan for group implementation on the mental health units. Some have happened, then we had some staffing issues, they had to scale back, and then we're trying to plan them back to get back on. Additionally, over the summer, we increased our substance use groups. So those returned back, not to the full steam that they were pre-pandemic, but they have come back to be able to start doing substance use groups over the summer.
And have incarcerated people been made aware that these groups are available?
The people that are qualified for the services and had applied and in the groups, or applied and in the program are aware. Yes, they're participating in them.
So these are only open to people that are in programs, like average Joe in a pod isn't able to come to these support groups?
For the substance use ones, no, because you would have to have experience with substance use and meet the substance use criteria for it. But the criteria for meeting those haven't changed at any point in time. Those are the same criteria as have always existed. Oh, no, I don't mean like only people with substance use disorder can go to substance use groups. I mean, you referenced the program, and I'm wondering if there's a program that like accepts a number of people who have substance use disorder, or how that works. Like, can anyone that self-identifies as having substance use disorder participate in these groups? So So the way that the criteria work is that they would send a request to our substance use program, then they would get an application, and once they have filled out that application and met the program criteria, then yes, they can participate.
Okay, and is there a limit on the number of people that can participate?
Yes, because of having the appropriate ratio between staff and patients.
Okay, and what is that limit?
At the moment, I don't have the limit off the top of my head, I'm sorry.
Okay, I mean, is it hundreds?
No, it's not hundreds.
Okay, and is there a wait list? Is there people waiting to get into the program?
Yes, so that we can keep the appropriate ratios between staff and patient.
Okay, and do you know how many people are on that wait list or the average wait time that people are waiting to get into these programs?
Off the top, no, I'm sorry, I didn't have that with me. So
Okay, and then also, thank you for that, thank you. Warden, you said that staff who mistreat people who are incarcerated will be held accountable. Can you talk about how that happens?
If we receive word that staff has mistreated incarcerated individuals, the employee will have a hearing to make that determination as to whether or not the infraction took place or not. The officer or the employee will have their union reps with them, and a decision will be made as to whether or not the infraction, if they committed an infraction.
Okay, and who presides over that hearing?
It could be many different managers. It could be captains, majors, deputies. It could be anybody, deputy health service administrators. It could be any manager.
Okay, so there's not a set group that hear all the hearings, it's just on a case-by-case basis, different hearing officers preside? Okay. Let me see. Okay, so next, in regard to mental health, I know that there have been numerous lawsuits in regard to mental health treatment, or I guess lack of access to mental health treatment in the jail. And I'm just wondering if there have, as a result of those lawsuits or just a result of garnering the information, if there have been any additional steps taken to try to prevent future lawsuits from happening.
I would think that it would be appropriate for him to talk about changes related to lawsuits. You want to ask him about changes?
I can rephrase my question. Thank you. So I'm specifically worried about violence against people with mental health diagnosis. I'm specifically questioning about use of force. I know we've discussed use of force statistics in this open setting before, so I feel it's appropriate to do now when we're talking about just so many people talking about how dissatisfied they are with their access to mental health treatment in the jail.
So what is your question?
My question is if you could talk to what you have done to address use of force against people with mental health diagnoses in the jail.
And we stated this several jail oversight boards as to what we do. We have a process where the individual we start de-escalation. And we do de-escalations on 3 or 4 different occasions before a use of force is done on a mental health patient. So the supervisory staff go and try to de-escalate the situation. We have the mental health staff come to try to de-escalate the situation. We have our crew operators come to de-escalate the situation. And all of this is on video of us doing these de-escalations. If all of that fails, which it has not lately, then we will use force to subdue the incarcerated individual.
Okay, and are there times where you're using 23-in-1 lockdown as punishment for these individuals you're referencing?
It depends on the severity of the infraction. If it's a mental health patient, we will speak to our mental health providers to make a determination as to whether it's acceptable or not. So it could be, yes, it could be.
Ms. Hallam, if I might, you're now asking questions, which are fine, but they're beyond the scope of the survey. And Ms.
No, it's
Klein-
not. 23-in-1.
Ms. Klein had a number of questions she would like to ask. I'd like to give her an opportunity to
Oh,
ask questions.
I can take a pause and come back to me later. Thank you, Ms. Klein.
All right, so thank you, Dean Farmer. I know this was birthing the 14 elephants or something, because it was such a long process. And I'd also like to just personally thank the people who are incarcerated at the jail for giving us all this information. It's really appreciated, and thanking the jail staff for allowing the process to happen. But I'm curious, that the DHS paid for some of the survey, and I'm wondering if, because I always thought it was coming out of the IIWF fund. So if you can tell me how much and how that discussion went.
Sure. And Dean Farmer, if you recall something different, please feel free. Yeah, we supplemented with about $10,000 just to make sure that there were enough resources to conduct a quality survey. I know $30,000 may seem like a lot for this, but in the work of research, I think it's actually not a ton of money. And so we just wanted to make sure that there was enough resources to do the kind of both data collection. They also had to input all of that data, which is a really onerous process, as well as analysis. So we supplemented with $10,000. The Inmate Welfare Fund put in $20,000 and for a total of $30,000.
All right, well, thank you. Thank you for that. Just, Dean Farmer, this is going to put you on the spot a little bit, but I'm wondering if what you think we could generalize. I understand this was a point in time, this survey, during pandemic when jail operations weren't as they normally are. But is there anything that you think we can generalize from what you found out from the survey to today?
I think I'm not in the position to be able to know that. However, I think that many of the things that we heard here, people were telling us that they had experienced them repeatedly, and that would mean that it wasn't just exactly on that day that they were reporting on. I really can't. I mean, it would be, I could speculate, but based on the data that we have, I think that we can tell you what it was like in September or late August and September of 2021. I think the question has already been asked about repeating the survey, and I think that would be the best way to answer that question. I think anything that we would attempt to make from this is a little difficult to do. We would be extrapolating from an unusual period, but there is a very easy way to answer that question, which is to repeat the survey or repeat a modified version of the survey that is more accurate for what people would want to know now, would be my response to your question.
Okay, thanks. And just by ending, I hope that the subcommittee could meet to talk about the results and, come up with some, hopefully, suggestions that we have, because we're sitting on a lot of money to spend to make a difference. So thanks again.
If I may offer, this is not an answer to the generalizability of the results, but just to underscore the investments you have made. I mean, the investments in the tablets and in the commissary, I mean, described as a lifeline for people to communicate to people on the outside, retain those kind of family relationships, read. And so I think I just would say that it does seem like from this period of time, those survey results reflect really strong investments in meeting those needs for the residents of the jail. So I just wanted to offer that.
And again, it is a question whether commissary should be necessary to meet people's needs, or that should come from the county and go above and beyond.
I think Controller.
Sorry, no, just two things. The RFP, so I don't know if I'm right or wrong. So it's going to be awarded next week, or it's out?
The commissary?
The commissary. I know the kitchen's a separate one as well.
We have to have the team that's put together to review the proposals has to submit their decision by the 7th.
But you've gotten the proposals.
Yes.
That was closed early August, just so I'm,
Yes.
okay, so,
Correct.
so you're going to ultimately reward it maybe next week?
Correct.
Okay, all right, sorry about that. Okay, that was a clarification. And then if we can do this is based on the survey, if it would help, I think it would help me definitely, if, we know this was a snapshot in time, could we possibly get a written response to the survey as to, these were the numbers then, here's what we have done since the survey was taken. So like when you're talking about 82%, 57%, we understand that was then. Just looking at the survey, generalize the questions. Can you guys provide a written answer to the survey. As to, this was a snapshot in time, here's what's occurred since.
Mr. O'Connor, we will look into that.
Okay.
Okay.
Controller O'Connor, do you want to make a motion to request that for the next meeting? Because I will offer a second.
Sure. Second.
All right, I'll second that motion. So we voted on one earlier that wasn't on the agenda. There's no rule for the JOB that says it has to be submitted in writing. So we have a motion and a second. Let's proceed. Do you want me to do a roll call? It's not your role.
The process is to make a motion. The motion wasn't on the agenda. So these two steps to the next.
You didn't object at an earlier motion in the meeting?
Do you have any other questions you'd like to ask?
I do have some questions I'd like to ask, but I would also like to see that at the next meeting. There was a motion and a second, and I vote yes. I don't know if anyone else wants to vote. Controller O'Connor, Ms. Klein, anybody want to vote yes to ask for that for the next meeting?
Question.
I just want to make clear that there are many times that we ask for things at these meetings and never get them. So that's the only reason I try to push a motion for, but I understand. So that actually, I do have a couple more questions, Judge Halsey. Thank you so much. So I think I left off at 23 and 1. I think that this is just really important to read some of these quotes because Warden Harper, has the jail been on lockdown in the past month?
We have been on split recreation.
Okay, and how many hours out of the cell a day do you get on split rec?
We try to give them as much out of cell time as possible. We try to get them as close to 4 hours as possible, but there are times that we do not.
So are there times in the past month where people have not gotten 4 hours out of their cell a day?
Yes.
Okay, did that happen this past weekend?
I don't have the data on me right now to talk about this weekend. That's something that I can get you at a later date.
Okay, I would appreciate that. And so I want to read what some people are talking about in the survey about being locked down the cell. Being in a cell for multiple hours causes loneliness, stress, depression, and suicidal thoughts. The quarantine process is inhumane. No rec, showering only every 4 days, cold meals, nobody will help you or answer any questions for you. Barely are given a tablet or staff because there, quote unquote, isn't enough. Completely inhumane. And I want to talk a little bit about that staffing issue because, the last meeting wasn't able to be here, but luckily my President Pacatina held it down. And I repeatedly saw him being denied access to information about staffing. And yet I read a city paper article today where the jail administration gave out very clear statistics: 359 full-time officers, 15 cadets graduating by the end of the week, no part-time officers, 37 full-time sergeants, 13 full-time captains, along with some comparisons to what staffing levels were like in 2009. I know that was, a while ago, but just some comparisons between staffing numbers then, staffing numbers now, population numbers. And something that we've consistently brought up on this board is finding out information from the jail that we have requested repeatedly, finding out from the press, right? We have asked this, not just my colleague at the last meeting, but also myself and other members of this board repeatedly over the past few years for staffing numbers. Can you please speak to why that information is given to the press, but not the members of this board who have a statutory duty an obligation to those numbers?
Well, Ms. Hallam, I assure you that it was nobody from this administration that gave staffing numbers to the newspaper articles. But next week, at our next Jail Oversight Board meeting, we were planning on giving the Jail Oversight Board staffing information that was requested from President Cantina. So next month, we will be giving those staffing numbers.
Okay, so are you claiming that the jail's PR person was not quoted in the city paper in an article today listing these staff numbers?
I did not read the article, so I cannot answer to that directly. So let me read the article and talk to my communication specialist to see if he did that.
Is your communication specialist named Jesse Gellenice?
It is?
Yeah, so that's who was quoted in the city paper today listing those exact numbers I just read.
Okay, I did not know anything about that, so if he did, I would talk to him. If he did, then he gave the information.
So what I'm wondering is, why is your communications person giving information to the press that you're refusing to give to us? We are statutorily entitled to that information.
Ms. Hallam, as I stated before, I was prepared to give those numbers at the next Jail Oversight Board meeting, so I can't answer that question.
This is the next Jail Oversight Board meeting that you were supposed to give those numbers at.
At the October meeting, I will be prepared to give you the numbers that Mr. Katina requested.
Did you not ask, were those numbers not asked of you to be given at the next Jail Oversight Board meeting, which is today?
Ms. Hallam, at the last meeting, we agreed that we would have to do an abbreviated agenda. That was not part of the agenda. He was going to give that information at the next meeting. We all agreed, last meeting. That was the agreement.
No, it was agreed. You decided that it was going to be a shortened agenda. There was no vote on it. I watched the meeting. You said, anybody have any problems with that?
I didn't agree or decide anything. Everyone agreed. I asked everyone how they felt about it, and everyone agreed there will be an abbreviated agenda with the primary focus being on the pit survey.
Okay, so then what I just want to remind you that you have a duty to us to give that information. We are entitled to that information that you have been withholding from us, whether it's October, November, December, whatever it is. We are entitled to information about people who have died in the jail. We are entitled to information about staffing issues in the jail. We are entitled to any information, any documents, any policies, any procedures, any information about the jail. If I have to, I will resort to the subpoena powers that county council has, and I will ensure that whether it's through a court order or in this gold room right now, that you will give us that information. And so instead of texting on your phone, if you could write that down to bring that information to the next meeting, because I know there was only a week between the last meeting and now. And again, I do want to express great displeasure with the fact that we went almost 2 months without a jail board meeting. One was scheduled hastily at the last minute for August at the very end of the month, 1 week before this meeting. So if you wanted to have 2 meetings back to back, you don't get to just shorten one. We have a statutory obligation to meet and get this information from the warden. So I would just like to make sure that going forward, you all know we need to meet once a month. First Thursday of the month is great. And I just want to make sure that you know what can happen going forward, what powers we have as elected officials who sit on this board, what powers we as the legislative body of county council have to force you to give that information. And I just want to, again, for the record note, we are entitled to that information, guaranteed that information by statute. So with that, I am going to just move on because I know it's public comment, but I wanted to again thank Dean Farmer. Thank you, DHS. Didn't know you threw in a 10K for us, so thank you for that. And again, of course, thank you to the incarcerated people that responded to this. I'm done, Judge Housing.
We'll now have a review of the minutes. Did everyone have an opportunity to review the minutes?
I'll motion to approve.
Is there a second? All in favor? Any opposed? Motion carries. Now move on to public comments. Just want to point out, we have a number of public comments, people who have signed up to offer public comments. Again, they are public comments. They're not questions, they're public comments. We will have 3 minutes to give your public comments. And we just ask that you be respectful in this process. So first person on the list would be Elaine France.
Hello, I'm Elaine France. I was wanting to make a comment, and I guess I intended for it to be a question, but I'll put it as a comment, which is I'm thinking about the fact that we have an election coming up. And I'm really concerned about the access of people in the jail to exercise their voting rights, to register and to vote. And I think that's super, super important, and I'm concerned that we know that a robust system has been set up to enable them to do that. And I'm actually thinking about several different categories of people. I'm thinking about people who are currently incarcerated but have not been convicted of felonies, and who will still be in the jail at the time of the election, and that's one issue. But I'm also thinking about people who are currently incarcerated but probably will be, or maybe don't know whether they will be, free by the time of the election. And then I'm thinking about people who will be arrested between now and the time of the election. And all of those people have voting rights. And not only do they have them, like we shouldn't be preventing them from voting, but we really need to actively facilitate their voting, because obviously they can't vote in a normal way inside the institution. And so I would really like some clarity and some transparency in what steps the jail is going to take in making that possible and educating people about what their rights are. Thank you.
Thank you. I appreciate that comment. Thank you. The next person on the list, and forgive me if I mispronounce your name. Some of these names are hard to read, but it looks like Jay Walker. That's a legitimate concern.
Hello, my name is Jay Ting Walker, and I'm here to speak on the posted book policy for the Allegheny County Jail and the lack of compliance with that policy. On your website, you list that softcover books sent from Barnes & Noble and Christian Books are allowed to be sent to incarcerated individuals with some restrictions on content. In policy number 430, the criteria for rejection is clearly defined. In previous meetings, the warden claimed that there are multiple people who reject books for various reasons. In the policy, it states that only the warden or deputy warden may reject materials. The policy also states, and I quote, "The jail's administration will advise the inmate and the publisher or other source in writing of rejected material and will provide an opportunity for response to the concerns that gave rise to the objection. Inmate appeals will be through the established complaint procedures," end quote. This is your policy. It is not being followed. Senders and incarcerated people are not being notified of the rejections and the reasons for the rejections. The process is so arbitrary that books about civil rights leaders are being rejected. An opportunity for appeal is not being offered, and the process to do so is not clearly defined. If the jail is not aware of their own policies, now would be a great time to brush up on them, as they are actively violating them. If they are aware of these policies and are choosing to violate them, then I demand the Oversight Board hold them accountable. Between inhumane lockdowns, denied visits, and limited recreational opportunities, people incarcerated deserve the right to read. Thank you.
Thank you for your comments, sir. Now hear from Marion Damick. But when does it go out, the RFP for the food?
Supposed to work this month on a specific day.
But so it still will be a conflict.
Well, I can do it here,
Have them come
do
in.
it there, wherever.
This one doesn't work.
Right.
Oh,
Okay.
woof, okay. Hey, I can't see the thing that's in my face. Okay, one of your members of the board has given me a perfect thing to speak up. The member, of course, who is never here, except in my time, I have seen him twice. And that's, remember how old I am. Twice I've seen this member at your board. Obviously, I'm speaking about Fitzgerald. So what does he do? He's going to spend $6 million to light up the 3 bridges, 3 sister bridges they call it, which are falling down anyway. What? True. Only 5% of that money is coming from the county. Our taxes, here I am taxing again. But, okay, look at what he could spend it on, besides, of course, the rats. What's happening at the county, at the medical care? You have no deputies, no director of nursing. You haven't had a director of nursing since April, probably even before. No director of nursing. No director of substance program. That's also since the years. No mental health. No, we have no. What you have a licensed practical nurse? No, she just left this month, or last month rather, left. So you have you do have some practical nurses, but none who's in charge. The things, I could go down here, and you all have it in the report. Look at what, mental health specialists, no, nobody ever specialist. Yeah, I thought we complained to Allegheny Health. You're paying, we're all paying for Allegheny Health to help here. What have they done? They have no medical director. They haven't had a medical director for 4 months. Is anybody saying anything? What's going on? You have to have medical directors, and you have to, and one reason you're not getting all of these is, also, you don't have any technicians, I mean, they don't have any technicians of X-ray, is what? Because you're not spending the money that you have at the right places. God knows, yes. Medical care, mental care, and the rats, and that type of care. Not for them, against them. That's where you should spend the county should spend the money. One of your members is in charge of the county. Tell him, your members there, don't let him get away with it. This time, he doesn't have anybody here represent. He doesn't even have his rep here. You're the rep, I'm sorry. I didn't recognize you because you said a word. Usually the rep doesn't. Sorry. Okay. Tell him what I said. He knows me. He lives right behind me. He knows me, and he knows what I'm saying. What I'm saying is the truth. Spend the money where it's needed and get the people who are in the jail out of the jail so that they can be productive citizens. That's my report.
Thank you for your comments. We will now hear from John Kostenowitz.
Boy, this is a tough act to follow. Okay, my first item, and I hope it's still relevant. A conflict of interest exists when the same contractor has both the food and the commissary contracts at ACJ. On December 31st, 2022, the food and commissary contracts at ACJ will be expiring. The economic incentives of providing low-quality meals to increase profits in the commissary contract are too great to let a contractor bid on both contracts. Recommendation: 2 separate RFPs should be issued, one for, not sure what's going on here, one for ACJ meals and another one for commissary items. A single vendor for both contracts should be explicitly prohibited. Item 2, provide quality orientation and training for the liaison. To be effective, the liaison needs knowledge of ACJ's procedures and operations and the vocabulary common to practice. The NCCHC 2018 edition, which is right here, Standards for Health Services in Jails, not only provides an orientation to these tools, but also provides standards of care for how a jail should function. The 162-page manual can be instrumental in knowing what to look for when conducting inspections. All 9 board members should have a copy of this manual that can be ordered online. Recommendation: the liaison and the 9 members of the Jail Oversight Board should each have a copy of the 2018 edition Standards for Health Services in Jails for the use in understanding jail operations, speaking about jail operations, and conducting inspections. Number 3, insist on meaningful disclosure of ACJ information to the public. Last year, Public Source completed a study of disclosure of policies related to mental health, suicide prevention, medication administration, and accommodations for people with disabilities in the 6 largest counties in Pennsylvania concerning their county jails. They found that Allegheny County's redaction of policies far exceeded other counties. 3 national experts disagreed with Warden Harper's excessive use of redactions and lack of transparency. In addition to ACJ's excessive use of redactions, why is Warden Harper's attitude about disclosure to the public and the JOB so different from those of the 5 wardens in the study? Recommendation: the county will contract with a nationally recognized correctional expert organization to assess and make recommendations on ACJ policies and practice regarding disclosure to the public and the JOB. Thank you.
Thank you. Thank you for your comment. All right, we'll now hear from Richard Garland.
Good evening. The reason why I'm here is I want to talk about the education of the juveniles at the ACJ. Why has a correctional officer, the one that was assigned to the juvenile education unit, been removed or reassigned with no replacement? You are now housing the juveniles, or having the juveniles remain on their housing unit for school. A housing pod is not the place, or not the proper place, for juvenile offenders to do school in it. There's no real classroom area. There's no access to technology. No computers in the classroom. Just because these young people are in the prison doesn't mean that we stop their education. Now, this is something that has been going on for a while. I want that changed, and this board has the power to do that. I'm brief. Thank you.
Thank you for your comments. Thank you, sir. We will now hear from Reverend Richard Freeman. Did he step outside? Oh.
He had to go. Am I permitted?
Sure, sure. If you want to speak, I was going to skip him and come back, but okay, absolutely.
Okay. Good afternoon. I hope you can hear me. I'm just going to step away because we don't have spray to sanitize the microphones. But my name is Minister Ella Scales, the Vice President of the Pennsylvania Interfaith Impact Network, and I'm going to read our President's comments. Reverend Richard Freeman, President of the Pennsylvania Interfaith Impact Network, and also he's the Senior Pastor of the Resurrection Baptist Church in Braddock, Pennsylvania. And he says, I stand proudly presenting a coalition of interfaith congregations compelled by our faith to action. 16 known souls demand we respond to the call of the Hebrew Scriptures, namely, to do justice, love mercy, and walk humbly before our God. It is that quest for justice and mercy we have the following 7 demands of those associated with this board. Number 1, incarcerated individuals receive immediate medical attention at their request at no cost, and that the determination to provide care not to be left to the correctional staff. Number 2, incarcerated individuals be given the ability to add, delete, or modify emergency contact information at their request during all stages of incarceration and custody, and that this request be processed within 1 day of the ask. Number 3, Allegheny County Jail to notify the emergency contact and the Jail Oversight Board with complete details around the incarcerated individual's medical emergency, hospitalization, or death within 2 hours of any emergency event happening. Number 4, family members or listed emergency contacts be allowed to immediate access to a hospitalized incarcerated individual. Number 5, transparency into medical records of deceased incarcerated individuals. Number 6, practical resources be made available for detainees and incarcerated individuals in the Allegheny County Jail. Number 7, a committee meeting with the Jail Oversight Board be held within 30 days of this demands that should be carried out. We thank you as we make justice and mercy a priority at the Allegheny County Jail. Thank you for your time.
Thank you, ma'am. Thank you for your comments.
Judge Halsey, point of personal privilege, I would like to make a motion to accept the recommendations that were just proposed.
We can address that for the next meeting.
You want to give me a second?
I do not. Thank you very much for your public comments. There's a process. It's not a while. There's a process, and we're going to follow the process. With that being said, we'll now hear from Reverend Rod Tate.
I am the pen organizer, and I agree with these demands.
Thank you for your comments, sir. Thank you very much. Ms. Tanisha Long.
Okay. So for the last Jail Oversight Board meeting, unfortunately, I was unable to make it due to the hasty rescheduling at the end of the month, 7 days before this meeting. I did submit a public comment, which was attached to the minutes. It was ignored. It was not summarized. That comment directly addressed the behavior at the prior Jail Oversight Board meeting, the lack of decorum, the disrespect, the haphazard way in which it was handled, but apparently that was not worth reading. I would like an answer as to why that happened, but it does draw a bigger concern that people who do submit public comments online are being ignored. They're being over-summarized. The impact of what they're saying is not being heard, and that's not right. There were only 9 public comments. They could be read in their entirety, especially given that A, this is an abbreviated meeting, and B, the last one was too. Moving on from that, I would like to say that it shouldn't take a survey to hear what people at this Jail Oversight Board have been telling you about the jail. Loved ones, family members, former incarcerated people have been telling you that these things are happening, and we only believe it when a social work school does a survey. Warden Harper, I would like to say there's nothing progressive and innovative about not having pads, tampons, therapists, clothing, fresh food, somewhere to sleep that's comfortable. That's not progressive and innovative, and I think you need a dictionary. What we're getting from the board is apathy instead of action. What we're getting from the warden is negativity, narcissism, and neglect. Should we care less that things happen because of COVID? Is COVID a catch-all? COVID was your opportunity to step up and meet the moment, not make excuses as to why things were the way they were. And to be clear, they haven't changed. So you're running out of excuses, and you've run out of actions. So at this point, I would like an explanation for why you blatantly refuse to do your job. And I would like an explanation for why, when the warden gets out of pocket and disrespectful, he is never chided in the same way Bethany is chided. And my final comment is I would really appreciate if you do not cut off members of the board while they are asking questions to things that the public watching this are not able to ask unless they come and do public comments a month later or submit one that's not going to get read. I want to know the answers to the questions she's asking. Please do not be disrespectful and cut her off. I mean, Lazara can't even show up because she's at the backyard brawl, but she comes every meeting and asks these questions. So I want to hear them. I want them answered, and there is no excuse that this should have been an abbreviated meeting just because it was haphazardly scheduled right after the last one. Thank you.
Thank you for your comments. I cannot read this last name, but I believe the first name is Wana.
She comes every meeting.
My name is Juana Saunders. I'm the mother of Gerald Lamont Thomas Jr., who passed away on March 6, 2022. If you guys don't mind, my anxiety is taking a little toll on me, so I would have my sister read what I wrote.
Hello, my name is Diane. I am the sister of Juana Saunders and aunt of Gerald Thomas. Her son passed away in this jail, and she will continue to show up until everyone incarcerated there is safe. She will not be going away, no matter how often you reschedule meetings. The past few meetings, we have heard about the horrible understaffing at the Allegheny County Jail. While we have heard about the effect that this has had on the officers, we would like to think what is more important to let us know what's happening with our incarcerated loved ones as well. Right now, there are pods that have been locked down for 23 hours a day due to understaffing. They have no family visits, no rec time, no legal visits, and this is in a place that is already miserable, joyless, unsafe, and unjust. We are taking away what few things they have to look forward to. This is inhumane. These are people, not animals, and in the past 4 months that we have been attending meetings, nothing has changed. Also, the ACJ's failure to staff is leading to cruel and unusual conditions for people in prison there. My sister has stood outside the jail. She has heard people talk about leaving and listen. She have talked to people leaving out of there, listening to how when they come out, their spirits are crushed by watching their loved ones being deteriorated. Now, what if it were you? Would you want to stay in a small cell for 23 hours a day? Do they not deserve visits from their loved ones? Is it not their right to a legal visit? We can talk about investigating the jail all you want, but are you going to do something about it? For the judges sitting on this board, sentencing people to this jail, knowing what is going on in there, how are you going to fix it? Is this just a hobby, or are you actually going to use your position to make some changes? Because we know Fitzgerald is not going to. If you refuse to act, then expect to see more of us, because we aren't going anywhere. And I just want to also add, as far as the communication between loved ones, parents, and the management, I can understand that you're running a jail, so you may be hardened, and it's just numbers and things to you, but these are our loved ones that are in there. So even for those who have contact information, I'm on people's contact information, my nephews. I done went through this 4 times this month. 4 times with my nephews, and I'm their emergency contact. And I do not like the way that I'm talked to, the way that I am shoved off, or the way that I'm not even being able to communicate with medical management, the warden, just in general. To me, it's very, I couldn't even understand. Now, there's no trust in this jail system because of the way I've been talked to within the last 4 months with my nephews. And I just don't understand it, because I am their emergency contact, and I have not been contacted at all. I'm always the one reaching out first.
Thank you for your comments, ma'am. Thank you, thank you.
And her name is Juana Saunders.
Thank you. We are now going to hear from Brandy Fisher.
Hello. I almost don't even want to talk because it seems like it's a waste of time in this place. I don't know if we're able to ask questions, but I would like to know, when people make comments, how do they get the answers to the things that they're commenting about? Like, where does those responses happen at? Is there a way to find that out?
There's a mechanism to respond, this
Huh?
is public comments, not questions, so.
Oh, okay. But I just wanted to know, because when we leave here, I would like to know, like, I heard a lot of things here that I didn't come to talk about that I now want to know the answers to, and I'm trying to figure out how do you get those. So first, I don't think there's too much I can say about what's happening at the jail that you haven't already heard. So I won't echo that. But I would like to know why there is no accountability for any of it. I mean, it's been going on for a very long time. The Jail Oversight Board is here for a reason, and I just don't understand how, after even hearing things that I didn't know in that report that Department of Human Services and Pitt put out, like, the reaction and the response was just null, just there. Like, it seems like you would be alarmed, heightened, or demand some accountability from the person who was employed there. I just don't understand what the Jail Oversight Board is doing or what we could expect from you all. You know, I mean, people don't want to come in here and be upset, antagonizing, but when you get this type of response, which is either nothing, apathetic, I mean, what do you expect people to do? And when they come and talk about like real things in a way, you know, forget how people are speaking. I don't care about his attitude, even though it disgusts me. It's what is being done. Like, beyond everybody's personality, beyond Bethany's personality that y'all don't like, beyond Wharton Harper's personality that nobody likes, what is happening with the people in the jail, and what are we doing about the things that are being raised? Like, these are very real things. I heard violations of policy being said. Like, there has to be a response to policies being violated, right? And you're clearly irritated, but so am I. Right? And so I don't understand, like, what are we doing about the things that are happening? You are human beings. If I came up here and said that your son told me that he's hungry, would you care? If I told you that your daughter said that she's not getting adequate medical care or getting her insulin, would it bother you? Would you care then? I just don't understand, like, why the attitude or why the lack of movement or the lack of action when people are just here being sincere about people that they care about that's locked in a facility. The last thing I want to say is that we went through a lot to get an ordinance passed so there was no solitary confinement in the jail. And all that I've seen since is ways to keep people locked up for 23 hours a day. And and Halsey, you're very intelligent. If you cannot see that that is intentionally being done, I'm starting to believe that you just don't care. Like, I don't understand what is happening here, that there's no accountability, zero change, zero effort, and I'm sure things happen behind the doors. People have conversations that we might not be privy to, but they're not translating to change. And that is the issue, and that is my comment.
Thank you for your comment. I appreciate it. Well, now, forgive me for the last name. It looks like Sharon Bonaviglia, maybe? Is that correct?
Close.
Sorry.
I spend my life spelling my last name. Sharon Bonavolia, the G is silent. Wow. Wow. I'm just going to start. Richard Lenhart, Robert Blake, Cody Still, Daniel Pastoric, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaugh, Paul Sipisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenik, Ronald Andrus. Those names should be read at the beginning of every one of your meetings until this changes. I've never been to this meeting before. I'm a suburban white woman, retired teacher. I'm an expert in 7th graders. I'm a taxpayer. I'm ashamed I've never been to this meeting before, and I am so grateful to those of you who show up time after time, and those of you on the board who are willing to speak out, because this is unconscionable. I leaned forward to ask someone how long this this warden has had this job? And I was told, Google it, so I did. 10 years? 10 years. How long is it going to take for this board to hold someone accountable for roaches crawling on a tray and rat feces in food? For women menstruating who don't have the sanitary products they need? And y'all know that that's just really and truly the icing on the cake. Because here's the cake: dead people. Dead people on his watch. So I'm here to hold myself accountable that, by God, I won't miss another meeting. And I am hopeful that Rich Fitzgerald can take some time to do his job and be here as well. And that there will be some respect, because as someone who is in the process of aging, ma'am, thank you for being here, for being heard. Even at a point when there are people who are somewhat amused by the fact that you would take the time to be here at your age with your infirmities. Did you climb those stairs?
I know. I got the elevator.
You got here before it broke. Somebody help her down the stairs.
I'm not going down.
I'm done today, but I'm not done. And this is unconscionable.
Thank you, ma'am. Thank you for your comments. I believe this is Ciora Thomas.
She left.
She left? Okay. Last but not least, Tim Stevens.
The request I have on the part of the Black Political Empowerment Project, BPEP, is that what was presented by these two ladies today be reviewed in detail by a team of folks from the staff and from the board, and that you create a timeline by which that will be done. My request is that you set the timeline within the next 2 weeks to begin the assessment of the work. Secondly, that you all respect this woman who speaks from her heart. What I heard today was beyond troubling. And to be honest, I was watching your faces. I didn't see the feel. I didn't see the passion. I didn't feel or see the upset. Now, maybe you felt it. What I thought of, if any one of you were sitting in this jail and you were dealing, let's say you were about to go to jail and you heard this report, I don't think you'd want to get there too soon. And I want you to think about it, if it was a relative of yours, if not you, someone close to you, would you want to be in that situation? I don't know about you, I can't stand a roach, even from a distance, let alone on my plate. This has to be handled. This is inhumane treatment. And Brandy, what was the percentage of people in the jail who haven't even been convicted as yet? Is it 85 or whatever? There's a huge percentage of people in the jail who have not yet been found, you're shaking your head, Judge, have not yet been found guilty of anything. And they're being penalized by these conditions. If I were a woman and couldn't find a sanitary napkin, I'd be pissed as hell. This is not right. And it's not funny. Well, you look like you are. But seriously, You've been there, Warden, 10 years? You ought to be ashamed that these conditions continue to exist. It is unacceptable. And no one on this panel should even think about allowing this to be acceptable. It should be an expeditious movement to fix it. If you have to get an extra contract, get it. If I'm in jail, I shouldn't have to pay money to get toilet paper or to get whatever minor things I need to live. And what Brandy did, APA and others, to get people out of that hole, that should not be played with. I worked at a mental hospital for 31 3/4 years. You don't need to be in those situations. You need mental treatment, not abuse. From a BPAP perspective, we had a 3-hour meeting Saturday with the League of Women Voters. We have a video. Matter of fact, Rich, who was here earlier, Rich Garland, has done the video, Oversight, the voiceovers. And Tanae Kroom, one of the greatest voices in radio, has done an oversight. We have one for people who are in jail. It is extremely detailed, and it is extremely correct. I'm asking that every prisoner, every inmate, every resident, whatever word you want to use, have the opportunity to witness that video. And that everyone who wants to vote, who can, be given a registration form, and they register before October 24th.
Is your time. I've given you well in excess of your time.
I appreciate it, but I hope you all take the time that you need to do what you need to do.
So just to be clear, I would not laugh at the conditions in the jail. I was not laughing at. There was a comment that was made that is categorically untrue, and I was a smile of astonishment that it's still being said when it's not true. I'm sorry? I would never laugh at the conditions in the jail, so believe what you want.
You and Harper. Harper's over here smirking in my face the whole meeting. The whole meeting right now.
Put your hand over your face, rolling your eyes. What comment was incorrect?
95% of the people in the jail are not there that have not been convicted of a crime. It's not 85% either. That is not true. We've discussed that on multiple occasions, but it's still being said. It's not 95%. It's not even 50. It's not even 50%.
Judge Halsey, only 5% of the people in the jail are actively serving sentences. The rest of the people are in there on detainers, awaiting gag-non hearings, awaiting trial. Only 5% are serving sentences for a crime in which they were convicted. That is a fact. Even Judge Lazaro, when she brought her stats in, did not dispute. You are lumping in people who are in there on detainers in with people who are serving sentences, and they are categorically different. And you know that's true.
You know what? You would know better than I just got here. So let's move on.
What number do you think it is?
Let's move on to the new business. Do you have a motion?
I do have a motion, but first I have a couple questions under new business since we were told to limit to about the survey earlier. So I have two specific questions that I want to ask before I get to my motion. So the first one is about the NCCHC audit on deaths in the jail that we have heard is happening. I'm just wondering if you can, since it's, I'm guessing, happening now, has it started yet, Warden Harper?
That was addressed last meeting.
But guess what? This is a new meeting, so I want to see if anything's changed since last meeting. If you want to have them a week apart, these are the things you have to deal with.
I think you understand why we had them a week apart.
I don't.
But you do.
The NCCHC audit that was announced for looking at our deaths in the jail is not a contract that was signed or entered into by the jail. It was entered into by the county manager's office, so we can't speak to it. As to date, I do not believe that they have made any requests of documents for us.
The NCCHC suicide review team came to our facility from August the 22nd to August the 24th. That was the review that was conducted.
Yeah.
As Deputy Thomas stated, the death review, NCC death review, is through the manager's office, so all questions will have to be referred to the manager's office.
So you haven't been requested that you provide any documentation to them yet, is really what I'm asking.
We have not.
And is there someone from the county manager's office in this room with us right now? Oh, Mr. Pilarski, since you're from the county manager's office, can you actually answer about that, since I believe it's the county manager's office that enters into contracts or authorizes contracts or something like that? So can you please answer that question?
That contract's not complete, so I can't answer it until it's complete. I mean,
So a contract has not even been signed for them to do it yet. It was just a press release saying that this might happen.
it's not officially signed.
Okay. And then my second question is for you, Warden Harper. It's specifically about juveniles coming into the facility. So, when I visit the juvenile pod, I see that it's all young boys in there, and I'm wondering, is there ever a time where a girl or a non-binary child comes into the jail?
There is.
Okay, and where are they housed? Are they housed on the same pod with the other juveniles that are all male, or are they housed somewhere else?
They're housed elsewhere.
Okay, and when a juvenile is brought to the facility, who makes the determination whether that juvenile is supposed to be, like when they're first brought in, right? So they're arrested, they're brought to the jail. Is there someone in the jail who makes the determination that this child needs to be held in the jail and not somewhere else? Who makes that determination? Like, who tells you, take this person, hold this person?
Judges, the court.
No, before it gets to the judge, before somebody gets arraigned, because you don't get arraigned the second you walk into intake. So I'm wondering, who gives the order to you to take in a juvenile into the jail pre-arraignment?
If a juvenile is charged as an adult, they would go to the jail. That's where they would go. They're charged as an adult, they're brought into the adult system. So
it's the DA signing off on charges that they're being charged as an adult? What I'm asking is, who signs off on that person pre-arraignment being charged as an adult and determines what happens going forward?
whoever files the charges, the person that files the charges would charge them with the charge that would qualify for them to be charged as an adult. There are charges that by statute, if you commit them, regardless of your age, you will be tried as an adult.
Okay.
It's by law. They're complying with the law.
Right, so I understand. So is there ever an instance where a juvenile is brought to your facility not charged with adult charges?
Not to my knowledge.
So you can't think of any incident where that has happened, where a juvenile was brought to the jail not charged as an adult or improperly charged as an adult when they were a juvenile?
At this time, not to my knowledge.
Okay, and so basically, I guess the essence of my question is, will you admit someone to intake on a police officer's order? Do you not admit someone unless the DA has signed off on it? How does
Police officer will have committing documents for the juvenile offender charged as an adult. So once we get those documents from the police officer, we will accept the juvenile that's charged as an adult.
Okay, and are those committing documents signed by anyone other than the police officer when you receive them?
I'm sure that it is, but right now I cannot tell you exactly who is signed by, Ms. Allen.
Okay, can you find that out for me, please? If it's a district attorney, or if it's somebody in the jail, or if it's the officer themselves, I'd be very interested.
Well, it's nobody in the jail.
Nobody in the jail.
I will make sure that you get that information.
Thank you so much. And with that, I will introduce, one more thing, is I just wanted to know, like, what happened last meeting, why it was scheduled so late, why you said we weren't having one, and then you ended up scheduling one last minute. Can you just inform the public what happened? I'm just wondering, because I was upset that I had to miss it because it was scheduled so late, and I'm just wondering why that happened like that.
You have a motion?
I do have a motion. Are you going to answer that question?
We can talk about it offline. You have a motion?
Yeah. I would like to make a motion to request money from the Incarcerated Individual Welfare Fund to be put on the joint tablet commissary accounts of each person. At the time of my drafting of this motion, there were 1,479 folks currently incarcerated in the jail. At $100 for each person, I'm asking for a total cost of $147,900. So I would like to make a motion to approve and ask for a second.
Is there a second? Motion's been seconded. All in favor?
Aye.
Any opposed? Motion shall carry. I just wanted to point out that I received a letter from Summit. The contract is up in December, so that RFP will go out sometime in October, late September, early October. And so they are indicating that they're willing to either answer questions in writing from the board or either attend a meeting if necessary. I think, personally, I'm putting this out there, but I think it would be inappropriate for them to come because it would appear to give them, if you allow me to finish, it would appear to give them an unfair advantage in the process if they come to the board. It's a bad look So I think it's better if we have questions, we submit them in writing, because we don't want to give the appearance that we are favoring one organization over another as they're submitting their contracts.
Judge Halsey.
Yes, ma'am.
Yeah, so is this different than what we were just talking about, that it's happening actually like next week?
This is food.
Food instead of commissary, but Summit is also the commissary person. So if it's always giving them an unfair advantage, then they can never come to us. And if you remember, this board actually voted to have somebody from Summit come. And so I would be amenable, if you're introducing the motion, Judge Halsey, to submitting written questions ahead of time for them to give them some preparation to get some general answers, and then ask them to also come here and answer questions to us as follow-ups for those.
So my question to you would be, and what do you do for the other organizations that are submitting a proposal who are now saying you've given an unfair advantage to one party by allowing them to come to the meeting and present and address questions when you haven't extended that opportunity to us?
Claire, if I'm wrong, please correct me, but I don't believe that process, that RFP process has gone out yet. I don't think that anybody has bid on the new food service one because it hasn't gone out yet, so we're not in the middle of it, so that's irrelevant.
But very good chance to go out by the time we next, but the commissary is out, that commissary will be decided.
But by our next meeting, it will already be over, so there will be no conflict. The commissary contract will be decided already, and the food service contract period has not yet opened, so that's basically saying that these people can never come because...
No, I'm saying once the contract's decided, they can come.
But maybe we don't want to sign the contract with them unless they come and answer, so I do think that's very pertinent.
You have to provide the same opportunity to any other potential bidder.
Only if we're in the bidding process.
And there's a chance we're going to be in the bidding process by the next meeting. We hope to have that.
Okay, well, can I respectfully ask that you not start it yet?
No, we don't want to delay it because it ends at the end of the year.
Yeah, you want
Then we have to extend the current one.
No.
Yeah.
Just because we wait until after the first Thursday in October does not...
Process that has to go into all.
Mr. Polarski, you're arguing in bad faith right now. This is the same argument that we can't get answers because of hypothetical potential future litigation that Mr. Bachrach always tries to say. We are not currently in a bidding process, so they would not be precluded from coming to speak to us, and this board had duly voted on having them come here. They are finally saying, we will stop ignoring you and we will come, so we need to allow them to come.
I'm not arguing with you. Bad faith, good faith. I'm not arguing with you. I will ask the solicitor for the purchasing department if it does provide an unfair advantage, yes or no. I'll let him decide. But the judge has comments that
we have a solicitor right here. We can ask. Mr. Bachrach, is there anything improper?
Solicitor.
But are you not a county solicitor?
In any event.
The county's a big place, and I don't know everything.
But do you have information regarding the bidding process for counties?
In any event.
Because I actually know that there is no improper advantage if the bidding period is not open. So if the RFP has not even gone out, bids have not been accepted at all.
If it's not open, I can't tell you if it will or won't be by the next meeting. That's the point.
You work in the county manager's office. Can you just make sure they're not?
So to that end, the reason...
We have to vote, by the way. Didn't we?
The purpose for me informing you of the letter that I received this week was to inform all of us. Please submit any questions that you have in writing so that we can explore that with Summit. And whatever we decide to do, the questions still need to be in writing. So please prepare any questions that you might have.
Just a technical on that. Are we preparing the questions then for the commissary, not the kitchen?
For the kitchen.
For the kitchen, okay. So not the commissary because they're going to be, well, I shouldn't say who's going to win the bid because I have no idea, but they're going to be gone. Well, I can't say that either. So this is strictly the kitchen because the kitchen is the next RFP that's out in possibly October. Is that correct?
That's correct.
Okay. So the questions we're going to ask are strictly for the kitchen, not commissary.
For the kitchen regarding the...
I disagree. I think if we specifically tailor it to the kitchen, then we might run into issues with we're giving them an unfair advantage for a future date. So I think we ask about, they've been the service provider for years now for commissary and food. I don't believe that there's any reason or need to limit it to just food.
I appreciate that you don't believe that there is. I'm getting text messages from people that work in the county that are saying there's no way to submit that question to have one person come in and not have all the vendors come in.
There are no proposed vendors for the food service contract, and the commissary contract will already have been decided by the next meeting. So that is true if we were in the process of the bidding process right now, but we're not, and we will not be by the next meeting.
Okay. So if you could just still prepare your questions, because they need to be submitted to Summit in advance, regardless of whether they come or not. If they're going to prepare written responses or come in person, the questions need to be done in writing. The other thing I'd like to tell you all is that Gail Moss fell. She was sustained a serious injury, which precluded her from coming to the last 2 meetings. I'd ask that you keep her in your thoughts and prayers. I wanted to also acknowledge Terry Klein for attending last week's meeting, and it was her birthday, and she skipped her birthday celebration. But more importantly, or equally as important, this evening would be her 37th wedding anniversary, and she forewent her wedding anniversary to come and meet with us. So I want to say thank you for your commitment to the board. And with that being said, Sheriff Kraus?
Motion to adjourn.
Wait, sorry. I just have to, I made this statement when I started, and I just want everybody to know. Encore, our criminal justice attorney, is going to reach out to each member for a meeting. He's housed in our office, but he's willing to help. So we just hired him on as staff at the controller's office. So if you get a call, he'd like to sit down with board members. That's all. Thank you.
Thank you.
He's in the back.
Thank you.